In the 1840s, Ignaz Semmelweis was a young doctor working in a Vienna maternity hospital when he noticed something terrifying. Women treated by doctors in the first clinic died at rates of 10 to 35%, while those treated by midwives in the second clinic died at about 4%. The difference was so extreme that pregnant women begged not to be admitted to the first clinic. Determined to understand why, Semmelweis rejected common explanations like overcrowding or poor ventilation. The breakthrough came when a colleague died after being cut during an autopsy. His symptoms were identical to those of women dying from childbed fever. Semmelweis realized doctors were carrying cadaverous particles from autopsy rooms to the maternity ward. They performed autopsies in the morning and delivered babies in the afternoon without washing their hands. Midwives did not perform autopsies, explaining their lower mortality rates. He introduced a simple rule. Doctors had to wash their hands with a chlorine solution before examining patients. The results were immediate and dramatic. Death rates dropped to around 1%. Semmelweis had discovered antiseptic practice decades before germ theory existed. Instead of praise, he faced ridicule. Doctors were insulted by the idea that they caused deaths, and without a scientific explanation for invisible pathogens, his findings were dismissed. He was mocked, rejected, and eventually fired. The pressure destroyed his mental health. In 1865, Semmelweis was committed to an asylum where he died just 2 weeks later at age 47, possibly beaten by guards. He died of septicemia, the very infection he had fought to prevent. Years later, Pasteur and Lister proved germ theory, vindicating him. Today, hand washing saves millions of lives, but the man who discovered its power died disgraced, a casualty of the ignorance he tried to overcome.